Senator Hassan, you may ask your questions.
Thank you very much, Mr. Chairman and Ranking Member Portman, for holding this hearing, and Secretary Mayorkas, welcome and thank you for your service. I want to start with a question about interagency coordination. At the end of 2020, even as the number of unaccompanied children began increasing, HHS capacity to shelter children remained limited. As numbers continued to rise in 2021, DHS mobilized support to provide care, speed up processing, and stand up emergency shelters. This included key assistance from Fema, which helped HHS open 14 emergency intake sites, as well as assistance from the U.S. Coast Guard and U.S. Citizenship and Immigration Services. The surge of unaccompanied children has slowed recently from more than 52,000 children transported to ORR facilities in March to approximately 20,000 children in April. Secretary, given that the volume may continue to fluctuate, is DHS prepared to remobilize personnel and resources from FEMA or other parts of DHS when it is necessary?
Thank you very much, Senator. Yes, we are. But to something I said earlier, we're also focused upon building the capacity for the Department of Health and Human Services so that it has the resources to address its elements of the process of the care for young children.
Well, thank you for that. But given the fluctuations, I just think you will need to have some flexibility there and supports available.
And we most certainly do. We have that capacity, that surge capacity, if you will.
Okay.
And the President has, in fact, directed on all of government effort to address that.
Thank you. Let me turn to a different topic. There are several interagency and intergovernmental programs designed to identify threats and prevent dangerous people from entering our communities. These include the Visa Security Program, the Refugee Admissions Program, USCIS processes to evaluate asylum claims, and the National Vetting Center within DHS. Secretary Mayorkas, do you believe that any of these vetting programs need to be enhanced to ensure that our programs can identify and prevent dangerous people from entering the United States?
Senator, we have tremendous vetting capabilities in the Department of Homeland Security and across the federal enterprise. They are very strong vetting capabilities, of which we are extremely proud, and of course, extremely proud of the personnel of the Department of Homeland Security that have developed and administer those vetting programs. But we never rest on what we have achieved. We are always looking at how everything we do can be strengthened and improved, and that is especially the case with our vetting programs, with the use of new technologies, new analytic tools, new sources of expertise.
Thank you. Now I want to talk a little bit more about how we vet sponsors for unaccompanied children. Coordinated efforts between the Department of Homeland Security and the Department of Health and Human Services have reduced the time that unaccompanied children spend in government facilities. However, I am concerned, and you've heard it from other folks here this morning, about the vetting process for sponsors. For example, in the past, HHS has sometimes failed to recognize that people who were sponsoring multiple unrelated children could also perhaps be human traffickers, that when they do that kind of sponsorship of unrelated children, they could be engaged in human trafficking, or that sponsors have failed to ensure that children appear in immigration court. So I understand that HHS has primary responsibility for vetting sponsors, but could you explain how DHS is working with HHS to ensure that sponsors are appropriately vetted to prevent human trafficking, to ensure that children are placed in safe environments, and ensure that sponsors bring children into the immigration proceedings?
Thank you, Senator. We have achieved and are continuing to achieve efficiencies in the process, but never at the expense of the quality in our administration of the processes. And that is quite evident in precisely the subject that you are focused upon, which is the vetting of the family, relatives, or sponsors of the unaccompanied children. It is precisely why we did not take from our volunteer workforce or our surge capacity workforce individuals unqualified to conduct that vetting. Quite the contrary. What we did was deploy experts in the vetting of individuals with respect to their identity and their qualifications. We took asylum and refugee officers who deal with these very issues in the hottest spots around the world and applied their technical expertise and experience to the vetting of the sponsors. And we are working as hard as we can to ensure that the mistakes of the past are not repeated. We learn from mistakes and we move forward. And that is precisely what we are doing in our support of the Department of Health and Human Services that does indeed have ultimate responsibility for that part of the process.
Thank you. Medical professionals have noted that unaccompanied children apprehended at the border suffer trauma before they ever enter DHS and HHS custody. Trauma from being separated from their loved ones, from being in the company of strangers, or even from mental or physical abuse prior to or during the journey to the United States. In a briefing to the committee, officials stated that DHS and HHS were focused on building trauma-informed procedures. Secretary Mayorkas, could you tell the committee about what DHS has done and what you further plan to do to address trauma experienced by children before they are in custody and to reduce trauma experienced by children while they are in custody?
Senator, we cannot overstate the trauma that some of these children have endured. It speaks to, on the one hand, the cruelty of some, but it also speaks poignantly of the resilience of the human spirit. It's remarkable what these children have gone through, but how they can see a better day ahead. It is our responsibility. It is the responsibility of humanity to address the needs of these children. And what we have done with our chief medical officer, an extraordinarily talented and dedicated individual, Dr. Pritesh Gandhi, is to see what these children have gone through, what their needs are, and to bring that health professional counseling at the earliest possible time in our operational processes. And the Department of Health and Human Services and their expertise in this area to bring those resources to bear so that it exists throughout the period. And one thing, why we speak of efficiency but not at the expense of quality, is sometimes it takes an individual time to work through the trauma they have suffered and articulate the claim for relief that they have legitimately under the laws that we have passed. And we're very mindful of that.
Thank you very much, and thank you, Senator Carper.
Senator